Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about borderline personality disorder. In this video, we'll first look at what borderline personality disorder is. We'll then look at some statistics, risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Borderline personality disorder is a chronic mental health condition that hinders a person's ability to regulate their emotions, particularly anger. People with this disorder can feel intense emotions after a triggering situation for long periods of time and have difficulty returning to a stable emotional state. Their difficulty regulating emotions can increase impulsivity and dangerous behaviors such as self-harm. It can also hinder a person's self-image and lead to unstable interpersonal relationships. These anxious relationships can be due to the previously mentioned behaviors, as well as an extreme fear of abandonment. Statistics. Borderline personality disorder affects 1.4% of the United States population. Females make up 75% of people diagnosed with borderline personality disorder. Risk factors. Research suggests that borderline personality disorder is a result of genetics, brain structure, and environmental factors. Genetics. A family history of borderline personality disorder increases a person's risk of developing this disorder as well. Brain structure. MRI studies have revealed that people with borderline personality disorder have 3 parts of their brain that were smaller or had unusual activity levels. These include the amygdala, which helps to regulate emotions, the hippocampus, which is involved in regulating behavior and self-control, and the orbitofrontal cortex, which plays a role in decision-making. Lastly, environmental factors, including childhood trauma and abuse. Up to 70% of those with borderline personality disorder are victims of emotional, physical, or sexual childhood abuse. Other environmental factors include neglect, abandonment, long-term distressing childhood events, and having a parent with a mental health condition or substance use disorder. Symptoms. The symptoms of borderline personality disorder typically appear during the late teenage years or early adulthood. The severity of symptoms can differ for each person due to different life experiences and predispositions. The symptoms of borderline personality disorder include having anger management difficulties. People with borderline personality disorder struggle managing their anger and frequently experience it intensely. An intense fear of abandonment. This can result in agitation during brief separation from loved ones. Sudden mood changes, including changes in their thoughts about themselves and other people. This can include short, unfounded, and intense feelings of anger, anxiety, depression, fear, hate, and love. Poor self-image. People with borderline personality disorder can often feel guilt or shame and view themselves as bad. Their self-image can also suddenly change based on the people they are around, as well as changes in their goals or careers. Dangerous and impulsive behaviors, including fighting, reckless driving, substance misuse, gambling, overeating, or unsafe sexual behavior. Self-injury, such as cutting, burning, or overdose. Up to 75% of people with borderline personality disorder engage in self-harm. Suicide. Around 10% of people with this disorder commit suicide. Volatile interpersonal relationships, including sudden and intense shifts in their feelings about other people, from admiration to dislike. Paranoid thoughts, dissociative states, temporary paranoia, and hallucinations can result from excessive stress. And lastly, emptiness related to loneliness, boredom, and unhappiness. Effects. If left untreated, people with borderline personality disorder have a higher risk of developing such conditions: anxiety disorder, depression, bipolar disorder, substance use disorder, and eating disorder. Borderline personality disorder can also lead to a higher risk of relationship issues, work issues, physical fights, car accidents, being in an abusive relationship, self-injury, suicidal ideation, or suicide. Treatment. The treatment for borderline personality disorder can include psychotherapy, medication, or a combination of both. There are several types of therapies that can help. Cognitive behavioral therapy. This therapy helps people understand how their thoughts affect their actions and learn healthier thought and behavioral patterns. Dialectical behavior therapy. This is the most common treatment, which educates people on how to adopt more open and flexible ways of thinking. It also teaches people problem-solving skills and acceptance. Mentalization-based therapy. This helps people understand the thoughts and feelings associated with the behaviors of themselves and other people as well. Schema-focused therapy changes people's negative thoughts, feelings, and behaviors into positive ones. Transference-focused therapy helps people understand how they perceive themselves and relationships. Systems training for emotional predictability and problem solving helps people manage their reactions to specific situations using tools. The last type of therapy is family therapy, which educates family members about the mental health condition and introduce coping skills. A healthcare provider may also prescribe medication to treat symptoms, such as depression. The medications can include antidepressants, anxiety medications, antipsychotics, and mood stabilizers. Coping strategies. There are several methods to cope with borderline personality disorder, such as getting enough sleep, eating healthy, engaging in physical activity to decrease stress and enhance mood, including taking a walk or dancing, identify triggers, listen to music, engaging in mindfulness. This can involve being aware of emotions without trying to suppress them, breathing deeply to stay present, and praying and attending weekly congregations during stressful times. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.